Well, flu cases all across the country are on the rise.
In Colorado, the CDC lists us under the very high active category. So let's talk about the flu with our 9 News medical expert, Dr. Kohli, who's joining us. This is also RSV season, flu season, and there's COVID still.
That's right. We're calling it the triple-demic. I personally got the flu just a few weeks ago. In fact, it's a quad-demic because you add norovirus into that as well. But it's been really bad this year, and for a couple of reasons. One, we're thinking the viruses are actually misbehaving more than usual. So if you look at the flu patterns, the younger people are getting into the hospital.
When you say the viruses, you're talking about the flu virus is misbehaving.
Flu virus is misbehaving.
It's hitting younger people more often. Why?
It's making younger people sicker. And we think a large part of what's driven this triple-demic is this apathy about vaccines. So if you look at the vaccination numbers, and the CDC report was from December, we have 17% of people vaccinated against these viruses. Some are 30. And so that's one of the reasons that the viruses have sort of taken over. Part of it is the vaccine design itself hasn't been very effective. Right. So the vaccine efficacy for flu has been rated at about 34%.
I was going to ask you about that because the RSV vaccine is, how would you say, effective on a percentage? Is it
We don't
60,
have enough
80?
data yet, Tom, because it's so new. So that vaccine just started about last year, and it's really for those highest risk groups, like those over 75 or pregnant women.
And then COVID efficacy, was that somewhere in the 50s? Or
Yep, so good vaccine efficacy is about 60-ish%, 60 to 65%.
And then the flu year to year goes wildly different, where it could be down in the 20s and up into the 60s or 70s effective.
Right. But here's the point I want to make. Vaccines aren't, the vaccine efficacy depends on how many people get the vaccine. So if you get the vaccine, but nobody around you gets it, that infection still spreads very efficiently, and it reduces the efficacy of the vaccine to keep you out of the hospital or make you sick. Now, we think the flu vaccine, even though it's not preventing infection, is preventing serious illness in a lot of people. So we still encourage everyone to get it every year.
Well, then if you do get sick, you're like, wait, is this the flu? Is this COVID? Is this RSV? You can test for COVID.
You can test for flu too, Kim. So it's the first year that we have an at-home flu test. In fact, I took it. You sent my mom to King Soopers. You can get it at Walgreens, King Soopers, Target.
I didn't even know that.
It's $20. You do the same nasal swab thing, and you can do both COVID and flu at the same time. RSV doesn't yet have an at-home test, but your doctor can actually mail you a kit if you call them from LabCorp, and you can do it yourself.
And that makes a big difference to know what it is.
Huge difference, because it affects your treatment. So flu, you can get Tamiflu. That has to be within 2 days of symptoms. For COVID, you can get Paxlovid. That's within 5 days of symptoms. For RSV, we don't have an antiviral. But it doesn't just affect treatment, it affects monitoring after. Because this year what we're seeing is it's not just the flu that's getting you. After you recover from the flu, a lot of people are going on to get a pneumonia or to get complications, and we've heard about long COVID. So the monitoring is also affected.
If you don't have $20 or you don't have time to get tested or whatever, what are the differences you could say, I feel this, it's probably this, or I feel that, it's probably that?
Probably hard to tell, because it's nasal congestion, fever, fatigue, and muscle aches that kind of characterize all of them. Sometimes the degree of fever and such can help you sort of know, is it more RSV, the type of cough can, but I would say that's definitely not a good way. You want to get tested and test your kids, because then you also can isolate people more effectively. You know how long they're infectious. It gives you a ton of information to test. So we want our eyes open when it comes to knowing what we're dealing with.
We don't have enough time to get into everything, but bird flu, are you really worried? I mean, we keep hearing about it spreading, and I'm concerned that it might mutate.
Yes, I'm not really worried right now for a few reasons. One, it's been around a decade, and it hasn't mutated to do human to human. That's not to say it won't, because it's doing more now. Second, we have a vaccine that's effective, that's given to poultry workers. And third, we have a treatment, Tamiflu, that works against avian influenza A, just like regular. So I'm not worried yet, but we still want to make sure we cook our food, cook our eggs. Don't eat any raw beef or raw poultry or anything like that. 165 degrees internal temperature.
When you said don't eat raw beef or raw poultry, I thought, I can do this.
I can do that too.
I can do that. Dr. Kohli, it's always good to see you. Thank you very much.